Firstly, I would like to thank NIPEC for the opportunity to be a part of their celebration and celebrating the International Year of the Nurse and Midwife. It is truly an honour and privilege to be here. From graduating from the School of Nursing, Ulster University, not that long ago in September 2019, I was excited yet nervous in starting my career as a new staff nurse. Throughout the undergraduate programme, I was always keen to learn, with a keen interest in how practice is evolving and changing to enhance care that we deliver as practitioners. I've always aspired to complete further education. Therefore, fortunately, that opportunity became available to me in September 2019 when I enrolled in the Nursing Leading Practice Master's Programme. This Master's Programme is a fantastic opportunity for newly qualified nurses. It is a new and exciting career opportunity, which I'm truly grateful to be a part of. Within the programme so far, we have undertaken modules in advanced communication through using the use of stimulated scenarios. Currently, we are undertaking a module in quality improvement, which is driven by the Quality 2020 Attributes Framework for Health and Social Care, which has identified a clear strategy for quality improvement across all tiers of workforce. We are all familiar with the quality improvement and the need to use data to understand variation and to improve services. This was first undertaken by the most influential woman known to nursing and midwifery, Florence Nightingale. She stated that it may seem a strange principle that the first requirement in a hospital is that it should do the sick no harm. Florence Nightingale was therefore a trailblazer in gathering data and statistics. She made data to win hearts and minds. When Florence Nightingale arrived in the British Military Hospital in Turkey, 1856, during the Crimean War, the mortality rates was high and the deaths were not recorded accurately. Florence Nightingale established much needed order and method within the hospital statistics. Nightingale's most influential presentation of her data was known as the Coxcomb. Her famous chart was evenly divided into 12 slices, representing months of the year, with the shaded areas representing the death rate that month. From the data, she discovered that more deaths occurred from disease rather than from battle. Therefore, she was determined to curb such avoidable deaths. By using applied statistical methods, she displayed her data. Data was collected from October 1st, 1854 until September 30th, 1855. From October 1854, Florence began to collect data. She discovered that more deaths occurred due to hospital-acquired infections rather than from battle. Therefore, Florence knew this was wrong and identified the need for change to recur these avoidable deaths. Through time and from analysing data, Nightingale learned that poor sanitary conditions was the main culprit of high mortality rates within hospitals. Therefore, she made a case for eliminating the bad practice that contributed to unsafe and unhealthy environments. From March 30th, 1855, she began implementing sanitary improvements, which demonstrated a substantial reduction in the amount of deaths that occurred within hospitals due to diseases. Therefore, Florence was able to identify the need to improve practice. She challenged this thesis and persisted in implementing changes which resulted in the improvement of care and patient outcomes. This demonstrated that quality improvement has always been and will always be a key component of the role of any healthcare professional. Therefore, there's a crucial need to lead the improvement and provision in high quality care and ensure that we as nurses and midwives strive to be transformative leaders in not only delivering a service, but to evaluate, challenge, engage in improvements that the service provides. Because if you always do what you've always done, then you will always get what you've always got. As a newly qualified nurse, I feel I've entered the profession in a challenging yet exciting time. And due to Florence Nightingale's statistical and analytical practice, she's paved the way for quality improvement today. My aspirations for my future career as a nurse will hopefully follow in the footsteps of the great practitioners before me. I hope to lead and develop in practice and improve patient outcomes with the service that we provide. I would also like to thank Professor McArdle and everyone else in the team for giving us newly qualified nurses the opportunity to undertake in this master's programme. Again, I'm honoured and thank you all for the opportunity in celebrating the International Year of the Nurse and Midwife. Thank you.